if you did own a piece of equipment that had the potential to earn you millions of dollars over your lifetime, would you take care of it? Running was great. It was me dependent. I could do it at any time. It was fantastic. Problem? I hate it. So unless you were going to put like chocolate in front of me or something, I had to figure out ways to trick myself into doing it. I know what's good. What can I do to do it? So very creative over the years. Always registered in races because it meant I had to train up to them, and that was going to happen. So I'd rather it happen and me feel better than not. I've selected very specific races in cities in which I enjoy. So, for example, one of them was San Francisco. I chose the Nike Women's Marathon. It raised money for cancer. Check. At the end, you got a Tiffany's necklace instead of metal. Yeah. There was chocolate given to you at kilometer 18. And the necklace was given to you by a firefighter dressed in a tuxedo. If I'm going to run, that's what it's going to be for. So 3 years ago, I was asked to do a talk about my research, which is on exercise and cancer, to a conference that was, the attendees were majority policymakers and physicians. I said, sure, absolutely. I got a scholarship from the organization that was running it. I'm happy to talk about what I've been doing. They said, great, you have 3 minutes. So I said, I can cough 3 minutes. This is what I've been doing every day for 5 years. They then wanted a script, okay? And they sent me an example script. This person had won a Nobel Prize. How am I supposed to introduce exercise like it's a new and novel thing? So as we go through this presentation, I want this to be the lens you view it through. I lied. I said, for the last 5 years, I've been in a lab and I've been developing a drug for cancer patients and survivors. This drug has already proven its effect on preventing cancer, up to a half of cancers. This drug, taken regularly during treatment, has actually been associated with receiving more chemotherapy on time, which is directly linked to survivorship. This drug, taken post-treatment for colon cancer patients, reduces their chances of recurrence by over 50%. I first found out about this drug when I was 16 and my best friend was diagnosed with cancer. I was 16. I didn't have a lot to offer in regards to medical advice. All I could do was suggest she take this drug as much as she could tolerate. I saw these improvements in quality of life. Her mood got a little bit better and she slept better. I'd like to note the side effects of this drug are immense. Lower blood pressure, better cholesterol, better mood. This drug, of course, is exercise. I had somebody in the crowd actually say, I'm sorry, I thought you'd be a millionaire. Unfortunately, it's just exercise. For the rest of the conference, I was called innovative. I was brought up in every single panel discussion about the girl that talked about exercise. This is not innovative. I assure you this has been around since the beginning of time. There's nothing new about this topic. It's how we view it. I asked CEOs how they fit exercise in, because a lot of high-ranking professionals do really well with exercise programs, and they're extremely busy. And they tell their EA, this is and I call them muscle meetings, this is my workout. It is not to be changed and moved. It is like any other meeting I have. Within your workplace, if you're considering a physical activity program whatsoever, make it social. I'm showing social network as in people, but also online. We are social people, most of us, and really thrive off of that interaction. From a behavior change perspective, if I'm going to go to the gym, if I don't, I'm only letting me down. If I'm meeting somebody, have a personal trainer, meeting a group, regularly participate in a group, and I don't go, there's somebody calling me out on that. Health is the sum of your daily habits. Like I said with the escalator versus the stairs, every day you get to make those choices. That is your health, the sum of them. Most days I take the stairs. Perfect.